Hello friends, welcome to Medical Marrow. I am Dr. Shivam Singh here. In this video, we are going to talk on symptoms of COVID-19 in children, how to prevent your child or a newborn baby from COVID-19, how to visit a pediatrician during this pandemic, how to cope up with this stress, etc. But before starting the topic, I would request you to please subscribe my channel if you have not subscribed yet and press the bell icon so that you would be updated about the channel activities. COVID-19 and children. There is much more to be learned about how this disease affects children. While some children and infants have been sick in COVID-19, most illness have been among adults. Some reports suggest that infants under 1 year and those with underlying medical conditions might be at higher risk of serious illness from COVID-19 than other children. Children with COVID-19 generally have mild cold-like symptoms such as fever, runny nose, and cough. Vomiting and diarrhea have been reported in some children. Children with certain underlying medical conditions such as chronic lung disease or moderate to severe asthma, serious heart condition or weak immune system might be at higher risk for severe illness from COVID-19. Call your child healthcare provider if you get worried about your child health or if your child has symptom of COVID-19. In case of emergency, call your local emergency department. Emergency departments have infection prevention plan to protect you and your child from getting COVID-19 if your child needs emergency care. Do not delay getting emergency care for your child because of COVID-19. Mask and face shield for newborn and infants. CDC recommends that every 2 year and above age child wear a face cloth covering that covers their nose and mouth when they are out in the community. Because of the danger of suffocation, do not put face cloth covering on babies or children younger than 2 years. Face cloth covering should also not be worn by anyone who has the trouble in breathing, is unconscious, can't move, or is otherwise unable to remove the face covering without assistance. Plastic face shields for newborn and infants are not recommended. There are no data supporting the use of infant face shield for protection against COVID-19 or other respiratory illness. An infant face shield could increase the risk of sudden infant death syndrome (SIDS) or accidental suffocation and strangulation. Infants, including newborn, move frequently, which could increase the possibility of their nose and mouth becoming blocked by the plastic face shield or the foam component. The baby movement could also cause the face shield to become displaced, resulting in strangulation from the strap. Now, I will tell you about safe sleep for infant during the COVID-19 pandemic. During the COVID-19 pandemic, parents of infants may experience increased stress and fatigue that could affect their infant sleep practice. Safe sleep is an important part of keeping infant healthy. Even during the COVID-19 pandemic, if you have an infant, you can help reduce your baby's risk of sudden infant death syndrome (SIDS) and other sleep-related disease by doing the following. Place your baby on his or her back for all times, naps and at night. Use a firm, flat sleep surface such as mattress in a crib covered by fitted sheet. Have the baby share your room but not your bed. Your baby should not sleep on an adult bed, cot, air mattress or couch or on a chair alone with you or with anyone else. Keep soft bedding such as blanket, pillow, bumper pads and soft toys out of the baby sleep area. Do not cover your baby's head or allow your baby to get too hot. Signs your baby may be getting too hot include if he or she is sweating or if his or her chest feel hot. Do not smoke or allow anyone to smoke around your baby. Well visit, that is routine checkup and routine vaccine visit for children during the COVID-19 pandemic. Routine checkup visits and vaccine visit are still important during the COVID-19 pandemic. Newborn visits. Ideally, newborn visits should be done in person so that your pediatric healthcare provider can check your baby growth and feeding. Check your baby for jaundice, make sure your baby newborn screening tests were done, and get any repeat or follow-up testing if necessary. At the newborn visit, your pediatric healthcare provider will also check how you and your baby are doing overall. Vaccine visit. Vaccines are an important part of keeping your child healthy, especially if your child is under 2 years old of age. Vaccine help provide immunity before being exposed to potentially life-threatening diseases. Although there is not yet a vaccine to help protect against COVID-19, vaccine for illnesses such as measles, influenza, whooping cough, and other infectious diseases are important for your child health. This will help to prevent outbreak of vaccine preventable disease among young children during the COVID-19 pandemic. Ask your healthcare provider how they are taking steps to separate healthy patients from those who may be sick. Some healthcare provider may choose to delay visit with well child checks and routine vaccine visit. This decision will be based on circumstances in your community and your child individual care plan. Call your provider office to ask about any upcoming appointments or about when your child vaccination are due. Coping with stress. Pandemic can be stressful for everyone. Fear and anxiety about a disease can be overwhelming and cause strong emotion in both adult and children. Coping successfully with stress will make you, the people you care about, and your community stronger. Talk with your children about the pandemic. It is important to try to stay calm and give children information that is truthful and appropriate for their age and developmental level. Children respond differently to stressful situations than adults, and if required, contact your healthcare professional. The next video will be about COVID-19 and pregnancy. Thanks for watching. If you liked the video, please hit thumbs up, and if you want to see more videos, hit the subscribe button too. If you have any suggestions, questions or anything to ask or say, please leave a comment below.